this session as well. And Miss Peggy, I'm sorry, I will have to get out of that habit, but Peggy, are you ready for me to begin?
I'm ready.
Okay, I think we might need to just wait one more minute in case some other people do join, and then we will get started. Well, I suppose we should go ahead and start. I don't see anybody else adding in. Well, are you all able to see that beautiful selfie that Miss Peggy sent to me? Awesome. Thank you, Kate. I will say Miss Peggy at the beginning. Well, Miss Peggy is a wife of 28 years to Mr. Jeff Richmond. They met in West Palm Beach, Florida. Together they have 4 daughters and 7 grandchildren, including the newest addition, Oakley Keaton Gaynor, who is just 2 months old. Before retiring, she put her degree in business and personal administration to work and became a human resources director for Reynolds Metals Company on the West Coast. Throughout her career, she also worked as an advanced management training director and owned her own consulting business. No moss gathers under her feet. She still continues to do consulting work from time to time, mostly as a volunteer, and has had a home-based Mary Kay cosmetics business for the past 30 years. She's been a member of FCE for 10 years in Grundy County and has held positions in their local club as president and treasurer. Currently, she's the county council president in Grundy County and holds the treasurer's position for the Central Region Executive Board. She became a health and wellness ambassador after Family and Consumer Sciences agent for Grundy County, Jennifer Banks, asked her to attend the training program. And since, in her retired years, her focus has been centered around being the healthiest and best she can be at 73, she decided that seemed to be a good thing in which to become involved. She believes the more she knows, the more she can share with others in her community through doing, not just talking about it. And that makes a big difference in the lives of others. She says she believes the Lord wants us to take care of our bodies and to be good stewards of the vessels He provided for us to live in, so we can have a good quality of life as well as a long life. Not to obsess with it, but this is a way in which we honor Him. She has a special interest of camping. She's a member of a women's travel and adventure club called Sisters on the Fly. I love that name. And their group is named because they like to fly fish, of course, and they like to travel. Peggy is an avid camper, often hosting caravans of up to 65 people, traveling and navigating places such as the Trail of Tears from Florida to Oklahoma. And she won't miss a step because right after that, she'll be connecting with another group of 45 women campers. They will have the chance to view the synchronous fireflies while camping in the Great Smoky Mountains. The women do their own towing, and she tows a Ford F-150, which is my dream truck. They set up their own campsites, they're campers, they do their own hitching, unhitching, and backing. They enjoy campfires and Dutch oven cooking. They do it all. Well, you can learn about a person from their favorite foods. So when asked what her favorite go-to healthy dish was and her favorite indulgence was, she replied for her healthy dish, a salad with fresh vegetables, leafy greens, topped with grilled chicken and dressed with a vinaigrette of olive oil and vinegar. Her favorite indulgence food, she was very specific. It's chocolate chip pecan cookies baked with almond flour, Lily's sugar-free dark chocolate chips, Swerve sweetener, and chopped pecans, and on occasion she adds cream cheese to the batter to make them moist and chewy good, or extra moist and chewy good. Well, with all of that energy and activity, I suppose I better make me some of those special cookies, because I really believe they must have the secret ingredient of the fountain of life included in them. So if you can do all of that, do what you do, and your favorite indulgence food is still considered extremely healthy, then you can definitely say a thing or two about being healthy. So on that note, I will turn it over to Peggy. Thank you so much for presenting for us today.
Oh my goodness, thank you, Kim.
You're welcome.
Y'all didn't know that you're going to get this biography on Peggy Richmond, I'm sure. But thank you for those kind words, and I appreciate that. We really need to, I'm so happy to be here this afternoon just to talk to you about health and wellness. Fortunately, we have to talk about things that are not all that positive when we talk about chronic diseases. But again, you know, the more you know, the better you can be at these things. And what I'm going to show you first, before we get into talking about the state of Tennessee and just how we sit and how adults fare with chronic illnesses and diseases, I want you to see this video. It's about 35 minutes. It talks about chronic disease, what is chronic disease, and then we'll have a time where I can give you some facts about how we are faring in Tennessee on this. And also have some time for some questions. And during this video, if you have a question, just hit it in the chat room, and then we'll talk about it when this finishes. So let me see if I can share this screen properly and start that video. So hold on just 1 second, because I got to see, yeah, there's where I want to be. Okay, now can you guys see this? Do you see chronic disease, common causes, simple strategies?
Not just yet. And you may have to stop sharing and then go back in again.
Okay. I haven't started it, but I wanted to know if you could just see the slide. Can you see the slide?
We don't see the slide just yet.
Okay.
Sometimes it takes it a minute to pull it up. All right, you're sharing. We see the slide. Awesome.
Okay, great. So we're going to start it now. And the person you'll hear on this video is Jennifer Banks, our Grundy County Extension agent. And I was going to do this, and then I thought, well, it's already there, so we're just using her. And I did get her permission, so we're good to go. Here we go.
Welcome to the lesson on chronic disease, common causes and simple strategies. Today, we'll discuss basics about common chronic diseases, diabetes, high blood pressure, and heart disease. We will discuss risk factors, prevention, and management. The definition for chronic disease varies slightly depending on the federal agency or organization. According to the CDC, chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention, or limit activities of daily living, or both. The National Cancer Institute defines chronic disease as a disease or condition that usually lasts for 3 months or longer and may get worse over time. Chronic diseases tend to occur in older adults and can usually be controlled but not cured. The most common type of chronic disease are cancer, heart disease, stroke, diabetes, and arthritis. In general terms, chronic diseases are defined as illnesses that last a long time, do not go away on their own, and are rarely cured. Chronic disease is the leading cause of death and disability in the United States. 7 out of 10 deaths among Americans are from chronic diseases. Heart disease, cancer, and stroke account for more than 50% of deaths each year. The Center for Medicare and Medicaid Services reference 19 chronic conditions: Alzheimer's disease and related dementia, arthritis, osteoarthritis and rheumatoid, asthma, atrial fibrillation, autism spectrum disorders, cancer, including breast, colorectal, lung, and prostate, chronic kidney disease, chronic obstructive pulmonary disease, also known as COPD, depression, diabetes, heart failure, hepatitis, both chronic and viral, HIV or AIDS, high cholesterol, high blood pressure, ischemic heart disease, osteoporosis, schizophrenia and other psychotic disorders, stroke. Nearly 60% of adults in the United States live with at least one chronic condition. 42% of adults have more than one chronic condition. 1 in 2 U.S. adults, 50%, report having at least one of 6 chronic illnesses: heart disease, cancer, chronic obstructive pulmonary disease, also referred to as COPD, asthma, diabetes, or arthritis. This module focuses on 3 chronic conditions: heart disease, diabetes, and stroke, with a focus on hypertension as a risk factor. For this activity, let's think about chronic diseases and the risk factors for each. Write down as many chronic diseases you can think of, and the risk factors associated with each. Label each risk factor as something that can be changed or something that cannot be changed. Risk for chronic disease are many. Blood pressure and high cholesterol are being overweight or obese, being physically inactive, having a poor diet, excess stress, smoking, age, family history, and ethnicity. As you can see on this table, the check marks go across each disease and risk factor. Additionally, each condition or chronic disease is a risk factor for others.
If you will put in the chat, are you able to hear everyone? Sometimes the system buffers.
Someone with low income may have limited food dollars and be inclined to purchase high-salt foods because they're less expensive. Some examples are fast food or potato chips. A second example of a risk factor impacted by external influences is excess stress. You may recall the social ecological model and the concept of social determinants of health from another module. Chronic stress is associated with excess stress. Some types of stress are acute or occur suddenly and then subside, like the stress you might feel when you're about to be late for an important meeting. In contrast, chronic stress persists for long periods of time. We know that people with lower incomes and fewer resources, and those who are ethnic minorities, may experience chronic stress that harms their health over time. For some individuals, taking steps to reduce excess stress may not make much of an impact on this risk factor. We can all learn to manage our stress better, but the main idea is that some of the controllable risk factors referenced here are not completely within an individual's control. When we are making plans as volunteers to help address these issues, we need to keep this in mind. Risk factors on this slide are associated with heart disease and hypertension or high blood pressure. We will address hypertension and stroke next. Next, we will discuss a specific chronic disease and contributing factor, stroke and hypertension or high blood pressure. Hypertension and high blood pressure are the same thing. High blood pressure is a major public health issue, as the United States map on this slide shows. States in the darker colors have higher rates of high blood pressure among adults. Can you find Tennessee? How does our state compare to others? Do you see any geographic trends? Uncontrolled high blood pressure can injure or kill you. It's called the silent killer because it has no symptoms. Many people don't know they have high blood pressure, so it's very important to get your blood pressure checked regularly. You might notice that the states in the southern U.S. have higher rates of high blood pressure than some other regions. High blood pressure is a major risk factor for stroke. On the next slide, we will show stroke death rates. This map shows stroke death rates among adults aged 35 and older in the U.S. Unlike the map on the previous slide, it is divided by state and by county. You may be able to find your state and county. Counties coded with darker colors have higher stroke death rates than counties in lighter shades. As you can see, most Tennessee counties are shaded the darkest purple, with a few pockets of lighter color indicating lower death rates. Can you see a pattern or similarity between this map, showing stroke deaths, and the previous slide, which showed high blood pressure? There is a pattern of high death rates in states with higher rates of high blood pressure. High blood pressure is a big deal. Age is a risk factor for high blood pressure. Is age a risk factor you can change or a risk factor that you cannot change? You cannot change your age, so the increasing rates of high blood pressure as we get older should be a concern to everyone. Among those aged 55 and older, more than half have high blood pressure. You probably had your blood pressure measured the last time you went to the doctor. Maybe you've used one of the automatic machines at the pharmacy. Have you ever wondered why the blood pressure cuff inflates on your arm and how that measures blood pressure? Or what the numbers displayed mean? First, blood pressure is the force of blood pressing against the wall of the arteries that carry blood away from the heart. Think about a water hose. Have you ever used a water hose that did not have good pressure and the water just trickled out? What about a hose that had really high pressure and was hard to handle? That relates to the pressure of water moving through the hose. The force of blood moving in your body is sort of similar. Blood pressure is recorded as two numbers, systolic and diastolic. For example, 120/80. When the heart beats, blood is propelled out of the heart into the vessels called arteries. Blood pressure is the force of blood pushing against the wall of the arteries. Systolic pressure is the top number in a blood pressure reading. Blood pressure is highest when the heart beats and the blood is pumped out of the heart into the arteries. Diastolic pressure is the bottom number in a blood pressure reading. Blood pressure is lowest in between heartbeats when the heart is at rest. One way to remember the difference between systolic and diastolic is that diastolic is down, the bottom number. It is also the lowest number in the reading. Diastolic and down both start with the letter D, making it easier to remember. Hypertension and high blood pressure are the same thing. Hypertension is blood pressure that is persistently higher than the recommended blood pressure range. High blood pressure increases your chance for getting heart disease and kidney disease, or for having a stroke. Hypertension is a blood pressure reading more than 140/90. About 1 in 3 Americans have high blood pressure. Once it develops, it usually lasts a lifetime, but it can be treated and controlled very well. Hypertension is a silent killer because it may be present for years without any symptoms. If hypertension is not diagnosed at the early stage, people will not find out it's present until they have trouble with their heart, brain, kidney, or blood vessels. Children are impacted by high blood pressure too. According to the CDC, about 4% of youth aged 12 to 19 years old have hypertension, and another 10% have elevated blood pressure, pre-hypertension. Youth with obesity have the highest prevalence of hypertension. This slide shows blood pressure ranges. You will see the normal blood pressure is less than 120/80. Someone in the pre-hypertension range should pay close attention to their blood pressure, monitor it regularly, and consult with your healthcare provider. And make lifestyle changes to reduce controllable risk factors. Those with blood pressure levels that put them in stage 1 or stage 2 categories should be under the care of a healthcare provider. Treatment will likely include medications and lifestyle modifications. It's important to note that someone with pre-hypertension can avoid advancing to hypertension stage when medication is required if they make lifestyle changes now. This slide shows blood pressure ranges for different systolic and diastolic readings. Some people think that blood pressure is considered high only if the top number, systolic, is above the recommended range. However, a person could have elevated blood pressure with only the bottom number, the diastolic, above the recommended range. It is important to pay attention to both numbers, top and bottom. Having high blood pressure makes the heart have to work too hard. The pressure of the blood against the walls of the arteries makes them rigid and hard, instead of flexible and healthy. The arteries throughout the body can become narrow and lead to reduced blood supply to the heart, such as a heart attack, or the brain, a stroke, or the kidneys, which will make a person need dialysis. Reduced blood supply to the legs can lead to gangrene and amputation. As you can see, the consequences of high blood pressure that's not treated or controlled well are serious. Uncontrolled or untreated high blood pressure can lead to aneurysms or bulges in the large blood vessels of the brain, intestine, legs, and aorta, the main artery in the chest and abdomen. These bulges can rupture, leading to severe consequences, including death. Anyone can develop high blood pressure. You might recall from a previous slide that age is a risk factor. African Americans are at high risk for high blood pressure. They get it at a younger age and more often than their white counterparts. Older adults are more likely to have hypertension. 60% of Americans over age 60 have high blood pressure. Being overweight and a family history of high blood pressure puts you at increased risk as well. And having blood pressure above the recommended range at the pre-hypertensive level puts you at an increased risk. Pre-hypertension can be treated with lifestyle modifications, but a person with stage 1 or stage 2 hypertension will likely need to take prescription medications, plus make lifestyle changes. Being overweight or obese is a major risk factor for high blood pressure. It's estimated that 75% of men with hypertension and 65% of women with hypertension can directly attribute the condition to carrying extra weight. Being more physically active can help with weight loss. Drinking alcohol in moderation and reducing salt and sodium are also recommended lifestyle changes. Most Americans, both adults and children, consume too much sodium each day. The dietary guidelines recommend no more than 2,300 milligrams per day. People with hypertension and pre-hypertension can benefit from reducing sodium to 1,500 milligrams per day. And according to the American Heart Association, limiting sodium to 1,500 milligrams a day for all adults, even those with healthy blood pressure levels, is ideal. The average daily sodium intake in the U.S. is 3,400 milligrams. Reducing sodium intake by 1,000 milligrams can help even if consumption exceeds recommendations. The key message is that nearly everyone can benefit from reducing sodium intake. We We've talked a lot about high blood pressure and how to prevent it or reduce your risk. One of the biggest health risks of having high blood pressure is that it increases your chance of having a stroke. A stroke is a brain attack caused by a blood clot in the brain that blocks blood flow. Permanent brain damage can be avoided or reduced for the most common type of stroke with a drug called TPA. The catch is the stroke victim must receive the stroke within 3 hours of the stroke occurring. This is sometimes called the golden window. Research shows that giving the drug past the 3-hour window can increase instead of decrease damage. That's why getting to the hospital is so important. Unfortunately, the 3-hour window is often missed because it can be difficult for people to get to the hospital within 3 hours of the start of the stroke. They may not realize they are having a stroke, or they may want a family or friend member to take them to the hospital instead of calling an ambulance. This slide shows how to spot a stroke using the acronym B-FAST. B, balance, loss of balance, headache, or dizziness. E, eyes, blurred vision. F, face, one side of the face is drooping. A, arms, arm or leg weakness. S, speech, speech difficulty. T, time, time to call for ambulance immediately. Learn the warning signs and act fast. Next, we'll discuss heart disease. This map shows heart disease death rates for adults aged 35 and older by county. Counties in the darker shades have higher death rates than those with the lighter shades. Do you see any patterns or trends on the map? How do you think this might relate back to the map showing stroke and high blood pressure? Where does your county rank compared to the others in the state? What about compared to others in the nation? Let's start our discussion of heart disease risk factors by talking about cholesterol. How many of you have had your cholesterol checked? Having high cholesterol is a risk factor for heart disease. Arterial sclerosis is a disease where plaque builds up inside your arteries, limiting the flow of the oxygen-rich blood to your organs. Some people call it hardening of the arteries. It limits blood flow and increases risk for the heart disease and stroke. Plaque, which is cholesterol, calcium, and other substances, build up in the walls of blood vessels. This can happen anywhere in the body. Coronary heart disease occurs when plaque builds up in the coronary arteries of the heart. The plaque buildup narrows the arteries and reduces blood flow to your heart muscle. This plaque can rupture and cause a blood clot to form. This further narrows the artery and the process repeats itself. Over time, the artery gets narrower and narrower, reducing blood flow even more. When you get your cholesterol checked, you may get several different numbers: your total cholesterol, LDL, and HDL. You may also get a number for triglycerides. People aged 20 and older should get cholesterol checked at least every 5 years. Total cholesterol should be less than 200 milligrams per deciliter of blood. HDL, the good cholesterol, protects against heart disease. For HDL, higher numbers are better. A level less than 40 milligrams per deciliter is low and considered a major risk factor. It increases risk for developing heart disease. HDL levels of 60 milligrams per deciliter or more help to lower your risk for heart disease. You can remember that HDL is the good cholesterol by thinking about H as healthy. HDL stands for high-density lipoprotein. High levels of LDL cholesterol are harmful. You can remember LDL is bad cholesterol by thinking of L as lethal. LDL stands for low-density lipoproteins. LDL cholesterol is considered the bad cholesterol because it contributes to the fatty buildup in arteries. Remember hardening of the arteries or arterial sclerosis from the previous slide? LDL cholesterol contributes to this. So unlike HDL, where higher numbers are better, lower numbers are better for LDL. Triglycerides can also raise heart disease risk. Triglycerides are a kind of fat found in your blood. A normal triglyceride level is less than 150 milligrams per deciliter. Levels that are borderline high are 150 through 199 milligrams per deciliter, or high triglycerides is greater than 200 milligrams per deciliter. You may need treatment for some people. High cholesterol is a risk factor for heart disease. Starting at puberty, men often have lower levels of HDL cholesterol than women. As women and men age, their LDL cholesterol levels often rise. Before age 55, women usually have lower LDL cholesterol levels than men. However, after age 55, women can have higher LDL levels than men. So based just on the LDL numbers, after age 55, in general, who do you think is more at risk for heart disease? Men or women? The answer is women. In fact, heart disease is the #1 cause of death in women. It also happens to be a top killer of men as well. But more women die from heart disease than men. 1 in 3 women die from heart disease. Other factors impacting cholesterol levels are diet, how much you weigh, how active you are, if you have a family history of high cholesterol, and of course, your age and gender. Now that we've talked about high cholesterol as a risk factor for heart disease, let's look at some other heart disease risk factors too. The heart disease risk factors on this slide probably sound familiar to you. Most of them are similar to the risk factors for high blood pressure and stroke. Risk factors that you can control are smoking, high blood pressure, high cholesterol and high triglycerides, overweight and obesity, physical inactivity, diabetes and prediabetes, which we will be discussing in just a few minutes, and metabolic syndrome, which is the name for a group of risk factors linked to overweight and obesity. There are also heart disease risk factors you can't control. One is family history of early heart disease. Your risk increases if your father or brother was diagnosed with heart disease before age 55, or if your mother or sister was diagnosed with the disease before 65. Women age 55 and older are at increased risk. History of preeclampsia during pregnancy is another risk factor. Preeclampsia is the name for high blood pressure a woman gets while pregnant if she didn't already have high blood pressure. Other risk factors can contribute to heart disease, including sleep apnea, stress or depression, too much alcohol, birth control pills, particularly for women over the age of 35 and smoke, anemia, and an unhealthy diet. Your risk is multiplied when you have more than one heart disease risk. The risk factors do not add up individually, like 1 + 1. The combination of risk factors increases risk more than if they were present individually. For example, being overweight increases your chance of developing heart disease and your chances of developing high blood pressure. And high blood pressure increases heart disease risk. Your risk skyrockets with each added risk factor. Most risk factors can be prevented or controlled. Family history, age, and a history of preeclampsia are beyond your control, but you can take steps to prevent or control other risk factors. For example, following a healthy eating plan and losing excess weight can help prevent high blood pressure. It will also help prevent high blood cholesterol, overweight, and diabetes. By doing just 4 things: eating right, being physically active, not smoking, and keeping a healthy weight, you can lower your risk of heart disease by as much as 82%. You can lower your heart disease risk by following a healthy eating plan. A healthy eating plan is low in saturated fat, trans fat, and cholesterol, and moderate in total fat. Include lots of fruits, vegetables, whole grains, and fat-free or low-fat dairy products. Lean meats, poultry, fish, beans, and nuts should also be in your diet. As we already discussed, if you have high blood pressure, cut down on salt and sodium. If you drink alcoholic beverages, have no more than 1 a day or 2 a day for men. Lose weight if you need to, and keep a healthy weight. To maintain a healthy weight, balance the calories you take in with those you use up in physical activity.
See, Adults in Tennessee suffer from some of the country's highest rates of the chronic diseases. Tennesseans are more likely to die from chronic diseases than most Americans, if you can believe that. Our rates of obesity are 45th. Diabetes are 44th in the nation. And heart disease is 44th in the nation. 1 in 3 Tennesseans, 34.8%, is obese. And that spiked 19% from 2012 to now to 34.8% of us. Diabetes, more than 1 in 10 Tennesseans has diabetes. More than 1 in 10. And heart disease, 1 in 20 Tennesseans has heart disease. And that's a significant increase over 2016. I think it was 4.9% then, it's 5.4% now. So high blood pressure is a real factor. The pervasiveness of chronic disease limits Tennessee's capacity to invest in education and our infrastructure, if you can believe this. The annual economic cost of diabetes for Tennessee exceeds the 2019 state budget for education. We spent in health costs and other related things, $6.6 billion out of a budget, and our budget for education was $5.1 billion. I mean, this really hits our pocket book, and by not taking care of ourselves. The annual cost of obesity for Tennessee is over 3 times what it was in 2019. The state budget for transportation, $3.7 billion. Transportation, that's our infrastructure, was $1.1 billion. Obese adults in the United States spend $1,900 in excess medical costs. Heart disease costs Tennesseans more than $5,600 per year in direct medical costs and loss of productivity. So anyway, how is Tennessee addressing obesity, diabetes, and heart disease? So the Tennessee Department of Health's Project Diabetes funds 20 3-year, $150,000 grant programs and 16 2-year, $15,000 grant programs to promote the development of healthy physical activity and eating habits. We'll give you an example. In Grundy County, we've got an $8,000 grant to improve our areas where we have access to physical activity. And FCE is in Grundy County is helping with that. We're going to put in exercise bars. We're going to put in a station that has water and a rest station along that goat trail. I don't know if you know anything about that in Grundy County, but we do. We have a goat trail, mountain goat trail that runs the length of Grundy into Franklin County. So FCE is helping in those areas. And with these grants through University of Tennessee, the Extension Office, that was part of the wellness ambassador program training that we got, and then the projects that we were going to do through that, and that's part of it. And I'm just really happy to be a part of that. I will give you a little testimony. In 2019, February 2019, I was on blood pressure medication. I had severe aches and pains and arthritis and stuff, and I was turned 70 that year, and I weighed 250 pounds. So I got interested in getting healthy, not so much losing the weight, although that was a good benefit, but getting healthy. And I did it through a healthy keto version. It was a low carb version, and intermittent fasting, but healthy stuff. And I've lost 88 pounds since that time, and I'm continuing to do more, thank you. And I'm off blood pressure and medication, don't have that. My cholesterol is fine. It did go up a little bit, but we expected that. My HDL is very, very good, and my triglycerides are just that, because I cut out sugar. When you cut out sugar, you do a lot for your health. So I'm just saying there are things you can do. I mean, I don't go to the doctor as much. I don't have those medical prescriptions. I don't have that expense anymore.
Wow.
So all of that is true, that we can control some things. The next steps in chronic disease prevention in Tennessee, and I think we are doing some of those things, prioritizing investment in community-based prevention would save Tennessee millions of dollars. So if we invested like $10 per person in a community-based chronic disease prevention program, we would save the state $351 million over 5 years. That's just mind-boggling. And I know how hard it is to lose weight. Otherwise, I would have done it 30 years ago. But it's a mindset, but it's educating ourselves. It's having access to things. A lot of people in Grundy County don't have access to what I do. And if we can help give them that access, for instance, a place to go to exercise, or training, or in our food programs, our what's that place where they give out food?
Food banks.
Food bank. That bank. That word. It'll help your mind too. Food banks to give out more healthy food, less processed food, that kind of thing. The state should follow the lead of Healthy Tennessee in its efforts to educate and empower communities about the importance of preventive health. And they are doing some of those things. And that's an organization that's taken a lead role in coordinating the efforts of community health nonprofit organizations such as ourselves. And I guess we're going to get out of here in about 56 seconds. So I'm going to say goodbye. Thank you for listening. And if you want any of this material, I'll mail it to you. Just email me or put it in the chat room or something. My email is prichmond09@aol.com. Hi, Mary Sue. Hi, Mary Sue.
At AOL.com?
Yeah, at AOL.com.
Okay. Well,
there.
Thank you so much for spotlighting those facts for us. And Tennessee does have a lot to offer. And thank you for sharing that information to us.
There's some good things happening. Not everything's bad.
That's true. That's true. We just have to look
right,
for the bright
Kate?
spots.
That's right.
You got it. You got it.
Thank you so much.
Thank you.
Bye-bye.
Bye-bye.
And it gets all muffled and I can't understand it.